Hi, my name is Hope, and today we're going to go over common care practices. These are things that you're going to do at the beginning of any tasks. Common care practices are behaviors or actions that are part of all home care aid provides to be efficient for a client. During the test, common care practices are evaluated as every part of every skill that the candidate performs. So remember, common care practices are at the beginning, the middle, and end of every task. The first common practice is identifying yourself to the client when beginning your care. So watch me carefully as I perform this skill. I'm knocking on the client's door. I'm coming in and I'm shutting the client's door for privacy. Hi, Mr. Client. My name is Hope Linder, and I'm going to be your healthcare aide today. How are you? That is identifying yourself to the client. At this point, you are going to then use infection control measures and standard precautions before you start whatever the assigned task is. This is when you would say, Mr. Client, today we're going to brush your teeth. Will that be okay with you? Great. I'm going to leave your room. I'm going to go wash my hands, and I'll be back in a minute. At this point, you then leave the client's room, shut the client's door for privacy, and go in and wash your hands, which is one of the tasks that we will go over during this session. So now you've come back, knocked on the client's door again, shut the door for privacy. Hello, Mr. Client, it's Hope. I'm back. My hands are washed. I'm now going to get some gloves on before I start brushing your teeth. This is all part of your precautions. Now I'm going to show you the proper way to put on your gloves. Never, ever do this. That's something you don't want to do because now you've contaminated the glove. The proper way to put on a glove would be get your glove whatever size, small, medium, large, or extra large. Put your hand in the glove and make sure it's up to your wrist. If they don't cover your wrist, they're not fitting you properly. We now have used infection control measures and standard precautions to perform our assigned task. Then we're going to promote the client's social and human needs throughout the procedure. We're going to make sure that the client is comfortable. We're going to make sure the client is in privacy, even when brushing their teeth. So you want to make sure if they have blinds in the room, that you close the blinds, that the door is shut. You ask the client at all times, are you okay? Are you okay, Mr. Client? Great. The next procedure would be promote the client's rights. Because you've been assigned to brush the client's teeth doesn't necessarily mean you will brush the client's teeth. We have to say, Mr. Client, would it be okay if I brush your teeth today? Mr. Client can say no thank you. It is his right as the client to decline services. At that point, we are not to push the issue. Do not brush the client's teeth if they refuse service. However, for this task, we're going to say that Mr. Client is okay with us brushing his teeth. Then you want to make sure that the client has safety throughout this procedure. Is Mr. Client sitting in an upright position so he doesn't choke? So if he's sitting in his wheelchair or a chair, make sure that you have a pillow properly placed behind him so he's sitting in the upright position. Make sure that the client's feet are on the ground. And also, if they're in a bed or bedridden, make sure the bed is up to a sitting position and pillows are properly placed behind the client. The next would be promote the client's comfort throughout whatever practice or task you're performing. Are you comfortable, Mr. Client? He may or she may say, no, my back or my neck. At that point, before you even begin your procedure or your practice, you'll make sure that the client is taken care of first. Then, when you are all done with whatever task you've been assigned, You're going to then leave the common use items with the client within reach. If they're in a hospital setting, make sure that they have their call button. If they're in their home, you'll make sure next to them that they have their cell phone or their house phone within reach, a glass of water, because they may not have another home care aide coming in for a few hours and they need everything within their reach. Make sure that if you sat them up for the task and they're bedridden, that you ask them, Mr. or Mrs. Client, would you like to lay back down? So these are all considered common care practices.